My name is Dwayne Michael Tippets. I'm an orthopedic surgeon with Anniston Orthopedics Associates here in Anniston. I also work at Regional Medical Center. I've been working as an orthopedic surgeon here for 9 years, and some special interests I have are joint replacement. I do hip replacements to include direct anterior hip replacements as well as knee replacements. I also enjoy sports medicine and fracture care. I also enjoy spending some time Friday nights with the local football teams, helping out on the sidelines. Following surgery, you'll have a waterproof dressing over the surgical wound, and depending on the surgeon's preference, that may stay on for 1 or 2 weeks. And the dressing is pretty low maintenance, nothing for the patient to do other than just leave it on and make sure that it stays completely sealed over the wound. And then in 1 or 2 weeks, you'll come into the office and the surgeon will remove that dressing and inspect the wound and make sure it's healing okay. So some potential signs of infection to be on the lookout for, other than drainage from the wound, excessive drainage that might be leaking out of the dressing. If you start to see any redness growing along the edges of the bandage, extending into the skin around that area, that can be a sign that may be concerning for infection, and you should come into the office to have a physician take a look at it. Also, any worsening pain over time. Generally after surgery, pain should be getting less and less with time. And sometimes you can actually develop a fever post-operatively if there is an infection that's starting to begin in the wound or around the implants. You can develop redness, swelling, and potentially even a fever. If you experience any worsening pain, that would be another reason to contact the office and have a physician evaluate you. Best way to prevent an infection is to make sure the wound stays clean and dry. And so being careful with the dressing, making sure that it stays sealed over the wound, making sure it's sealed before you get in the shower so that no water can leak underneath the dressing and contact the surgical wound. That'd be the most important thing. In the early postoperative period, in the first few weeks after surgery, we generally recommend ice to help with the pain and swelling as opposed to heat. I think heat can actually stir up some more pain and some more swelling, so we generally recommend avoiding the heat and really sticking with the ice in the first few weeks. If you're interested in contacting me or my team, you can find our information at rmccares.org.